Hi, everybody. Welcome. Let's see, let me back the slide up one. My clicker is not working. 1 second, please. Okay, let's try it the old-fashioned way. Well, anyway, welcome to our webinar. We're going to talk about SofWave today. I am Susan Van Dyke. I'm a board-certified dermatologist and I've been practicing dermatology for over 40 years, believe it or not. I don't believe it. But the last 30 years of my practice, it's been 100% cosmetic. Cosmetic meaning fillers and injectables of all kinds like Botox and that sort of thing, as well as energy-based devices. So last month, we met and we talked about Agnes, which is an energy-based device for tightening and lifting. And today we're going to talk about SofWave, which is a different energy-based device. The advantage of SofWave is it's completely non-invasive. That means there's no downtime really whatsoever. You can have a little redness and that's about it. So while we're waiting for our slides to kick in, what we're going to be doing today is I'm going to review for you a little bit about aging and my approach to assessing a cosmetic patient. Secondly, we're going to focus on laxity, which is our subject today. That's skin sagging, basically. And, what is a simple solution to that, which is SofWave. And then thirdly, we're going to go over the SofWave experience, what it's like to have SofWave done. And we have our lovely model here, Tracy, and she's going to have a demo. Now with Tracy, she's a really great model patient. We actually did do Agnes on her a month ago, which is for lifting and tightening. And then what we're going to do today is actually a complementary treatment called SofWave. So SofWave can be a standalone, or it can be used with other treatments, for instance, Agnes. So we'll be doing a SofWave demo on her as well. Now I'm sad, but we may not. Oh, we have slides. Okay, thank you, Annika. This is my right-hand woman here. All tech. All right, so let me back this up just a smidge. There we are. Okay, there I am. Aesthetic dermatologist, 40 years, Scottsdale, Paradise Valley. Had my own practice for the vast majority of that time, but am so pleased today to be working with Clear Dermatology. I'm here a few days a week, and I am specializing, as I told you, in injectables and energy-based devices. First is our aging, second is our solution, and third is our SofWave experience. And then if you stick around, we have a demo as promised, live treatment, questions and answers. I believe you can put them into a chat and we'll get to them either at the end, or if not, we'll get back to you. And then lastly, webinar specials. We always do that. When we do a webinar, you get a special deal because you've been educated for this whole thing. So let's start with aging. There's basically two essential kinds of aging. There's intrinsic and there's extrinsic. Intrinsic means what's innate to you as a human. So that's your genetics, and that's how long you've existed on the planet. And the main effect of intrinsic aging has often to do with volume. So volume loss is typically something that's genetically or age related. There are other effects too. But when we look at quality, this is not the real Cameron Diaz. This is Cameron Diaz aged as if she had never taken care of herself. So you can see the skin quality is not good. She has blotchy skin. She has a lot of fine lines and wrinkles. This kind of change, as well as sagging is both intrinsic and extrinsic, comes with what happens to you in the world or your lifestyle. So how much sun did you get? How much pollution is in the air? Things you can control and things you cannot control. Arizona, unfortunately, we have a lot of very hot temperatures. So I'm not a big advocate of hot yoga, although I know a lot of people love it. Not the best thing for your skin. And then things that you can control, smoking and alcohol are, of course, the big evil ones. Now, this is the real Cameron Diaz, and obviously she has taken good care of her skin. So if she came in to me for a consultation, I would look at 4 things. And this is with any of my cosmetic patients. Even if you come in and you say, I just want Botox, I do look at the whole picture. And if you're interested, we can talk about it individually or on what your options are to achieve your goals, basically. So she's aging well, but we look at the quality, like how pretty is her skin and how it glows and how even it is. Movement has to do with, frowning and smiling, which causes wrinkles. Volume, which is this nice fullness, and then laxity, sagging, which is our subject today. Quality is tone, texture, color, pores, fine lines, wrinkles, everything on the surface. And it is best addressed with skincare and resurfacing. Resurfacing can mean a laser, it can mean chemical peel. In the old days, we used to do dermabrasion. Now we do more microdermabrasion or spa treatments that just kind of refine the surface. This patient, it's a real person, but she looks like a doll, pretty much because she has a filter on her skin. She has no pores. She has perfect skin. This is unrealistic expectation. Pores are very important. We do need pores. So we have to keep a realistic expectation in mind when we're doing these things. Movement's a big one. Most everybody knows about Botox. Movement is when you make a face and you get a wrinkle. And when you don't make the face, the wrinkle goes away. At least when you're a child, it goes away. As you get older, the wrinkle may not go away because the lines will get etched in. This area here, the glabella or the 11s, the frown lines, that is the classic area that people want to get treated with Botox. You relax the muscle, you relax the wrinkle. Also crow's feet, many areas on the face we can treat with all the neuromodulators, the most famous of which is Botox. Volume is the third category I like to look at. And volume, if you think about a face, it's when you're young, you have little fat pads all over the face that fit together like a jigsaw puzzle. As you get older, those fat pads kind of thin out and they descend, and that gives a very characteristic look to an older person, even if their skin quality is great. So volume is a big player here. And fillers, fat transfer, Sculptra, those are things that help volume. And laxity is our main subject today. So laxity has to do with sagging. It has to do with the loss of collagen and elastin, which is what's in your skin. It makes it firm and makes it bounce back. Now, it does not stand alone. That's why movement, quality, and volume are really important, because addressing all those give you your best result. But let's focus on laxity today. And now here our model is smugly looking there, very nice and firm. And that's because 29 is the best year you ever have with your collagen. Past the year of 29, you don't produce collagen and elastin as robustly as you do when you're young. So what are we going to do about that? Well, there's the aging face. There's a patient with very severe laxity. And you can see gravity does play a role. If we were in inversion boots all the time, we wouldn't have jowls. We'd have sags above our forehead. So that's where the laxity is showing based on gravity. But the laxity is just looseness of skin. Another way to look at it is a lack of bounce back. So in mild laxity, you might have a tiny bit of a baby jowl. You pull on the skin, it stretches out, but when you let go, it snaps back beautifully. Moderate laxity is a little bit further along. There you do have some jowls. When you're pulling on that skin, it has a tendency to slowly get itself back into place and doesn't go all the way back. And then with severe, really the sagging is kind of, there's not a lot of elasticity left. You don't have a lot of bounce back. So let's talk about the solution. There's no point in bringing up a problem unless you have some solution. Our solution today we're talking about is called SoftWave. It is an ultrasonic technology, and it is 100% non-invasive. You'll see when I do a demo, nothing breaks through the skin whatsoever. And what it does is it triggers your body to regenerate collagen and elastin. It basically gives it a kick in the butt, like you're over 29, you're not making so much collagen anymore. It's like, remind it what to do. SoftWave has a lot of uses. The main outcome of a SoftWave treatment is firming and tightening. The results are very natural and they last a long time. They last a year to 2 years. And where can you do this? Well, you can, and we'll show you some pictures. You can do a brow lift. So you can tighten and firm the skin above an eyebrow to get a bit of a lift. Jowls and lower face, a very, very popular area to get. And we're going to demo that area today. Also, the neck can be firmed. Crepiness on the upper arm, like that underside of the upper arm, is a very common complaint after a certain age. And frankly, you can firm and tighten almost any skin on any area of the body with this treatment. So let me explain to you what the concept of how it works is. You know, if you take a sweater, a wool sweater, and you throw it in the dryer, it's going to shrink. Well, why is that? That happens because the sweater is made out of fibers that are proteins. When proteins are heated to a specific temperature, they reconfigure, they literally shrink, and then the entire area shrinks. So this is what we're going to tap into, this concept to cause a bit of a shrink wrap effect on the skin. So what SoftWave does is it uses ultrasound. You know, ultrasound is what you use to look at pictures of babies. So it's harmless, right? But if you focus it to a high degree, you can get it to trigger heat generation. So think of it like sun feels good on your skin, but if you put it under a microscope or a magnifying glass, it will focus it and it will create heat. So that's what we're doing with the ultrasound. We're focusing it. So this ultrasound then produces heat. Heat tightens the collagen and elastin. The collagen shrinks and it triggers the body. So you'll see it immediately. It's very subtle. You can see it on our demo patient, Tracy, today. I did one side earlier, so we have a very slight tightening on one side, but that is not the end result. That is the collagen change that then stimulates the fibroblasts in your skin. Those are cells that produce collagen and elastin. So it says, wake up, give me more collagen and elastin. So you basically poke the beast. The beast is going to make you new stuff, and it takes a while. It's not instant gratification. It'll take weeks, even a few months. Think of it like fertilizing your lawn. It takes time. So SoftWave is the name of our instrument. So why SoftWave? Well, SoftWave in particular is well known for natural skin regeneration, collagen, elastin, and also HA. HA is hyaluronic acid gel. That is kind of, think of it as like the jello part of the skin. These are all natural, normal components of skin. 100% non-invasive, no downtime. We say minimal because you could have a little pinkness, maybe a mild amount of swelling, but honestly, nothing to keep you down. It's a consistent result on all skin types. So, you know, some things you can't have lasers if your skin is very dark or if you've been in the sun recently. It doesn't matter in this because it skips the pigment layer. So it's considered a colorblind treatment. And it has a very high safety profile. You don't get damage of underlying structures because it's so focused specifically on the skin. This is a little cartoon that kind of shows you what's happening under the skin. So you see that skin, that's a SoftWave transducer. The blue is cold to keep the surface cold. And the red is the heat that is specifically in that collagen layer called the dermis. And that's what one pulse of SoftWave will do. So it will cover a pretty good area. And here's that cartoon again, not moving. So you see the blue is the cooling spray that happens, or it's like putting a piece of ice on the skin. It feels cool. And that protects the top because we don't want to affect the pigment layer, right? And then the heat via the ultrasound is directed to the lower part of the skin. So surface is kept cool, deeper layers are heated, and the pulse takes about 5 seconds for this to happen. What you experience is cool, then warm, and slowly you feel a hotness right before it's over. A lot of people say, well, how is this different from other technologies out there? So SoftWave is on your left. And then another really excellent technology, this is called HIFU. It has another trade name. It also uses ultrasound. It's different in the ultrasound is deeper, more intense, and little fine pinpoint areas of heat. So the SoftWave in this situation has the advantages that you have more volumetric heating, meaning it's heating a larger volume of the dermis, specifically the collagen layer. Here is Sofwave again on the left, and on the right is radiofrequency microneedling. Now, again, an excellent procedure. You're familiar with microneedling. This really is not microneedling, but it's using the needles to get radiofrequency deep in the skin. Radiofrequency is just another way, like ultrasound, to generate heat. So you can see in the cartoon these little brown, little, looks like sticks, but that's actually the needle going through the skin. And the heat is only generated at the tip of the needle. So it's less volumetric, it's more of a precision or a thinner layer of heat. So Sofwave, if you're wanting in generalized firming and tightening, Sofwave has the better technology. And then lastly, compare it to lasers. We do a ton of lasers. We do a lot of the other procedures as well, but lasers basically go through the skin and purposely are causing damage to the surface skin. So this is the kind of treatment that's ideal for resurfacing, like our old Cameron Diaz picture. Crepey skin, blotchy skin, even pre-cancer. So lasers do cause some damage to the surface. They cause minimal heating underneath, so you don't see a lot of tightening with them in general, but you get an improvement in the surface. So specifically, let's home back in on Sofwave. There's the machine. And this is basically what the federal, the FDA clearances are. FDA clearance means that studies have been presented to the FDA, clinical studies and research studies. They look at all the evidence and then they decide, okay, this is good for these particular treatments. In our case, we're talking about improving facial lines and wrinkles, lifting of the eyebrow, lifting of lax submental. That means like under the chin, double chin kind of thing, tissue. Improve the appearance of acne scars. That has to do with increasing your collagen and elastin, which makes the surface look better. Lifting lax neck tissue, which is a big problem for many. Short-term improvement even in the appearance of cellulite. So it's not really treating the cellulite, but when you firm and tighten skin above it, it does look better. And also, as I mentioned earlier, the skin that's crepey and lax on the upper arm. So here's a patient before, and what you're seeing on the right-hand side is a cartoon of it's obviously not her, but the blue squares are sections that will be treated with Sofwave. So those squares are oriented in order to produce the result we want to produce. So for instance, you have two squares right above the jawline. We're looking for that lift in this direction. When the square is up here in the temple, you're looking for more around the eye, brightening and lifting. And then above the eyebrow is the brow lift. In each square, a certain amount of pulses of Sofwave will be introduced. So the technique, which is a new protocol over the last year or so, has given us much better results, in which case we take a measured square and we deliver a specific amount of energy. If you have mild laxity, that energy might be, say, 50. If you have moderate, that energy might be 75 or 100. And if you have severe laxity, we would go to a higher energy. And these are all things controlled on the machine. And I'll show you that when we do the treatment. And here's the patient that you just saw, and it's 1 month after. So at 1 month, you're seeing some results. Excuse me. However, results continue to improve. Certainly 3 months is where I like to judge it. Do we need to do another treatment? Because you can do another treatment. A lot of times you don't need to. And then you'll still see gradual slow improvement even as long as a year. And here's an older patient. I'm going to show you a lot of before and afters because I think it's really helpful. Everybody gets a bit of a different result and everybody starts out looking different, right? So here you can see her nasolabial folds are softer, which is these folds that go from the nose to the corner of the mouth. Her marionettes are softer. Everything is just a degree softer. And this is at 3 months. Now, she's very happy. So we're very happy. She looks completely natural. She looks just like herself. Can we do another treatment to get further improvement? Yes, we can. Here we have a very thin, older woman. And if you look in her mid-cheek area, you can see how that skin has tightened. Could she use another? Of course. But you can absolutely see what Sofwave is doing. And if you're looking at the whole skin, you'll notice her skin quality looks better. She has more of a glow. And that happens anytime you increase collagen in the entire surface area as the skin is healthier. And and happier. This is an interesting patient because if you look at the left, it looks like she's got some volume loss, you know, down, we call this the tear trough that goes sort of from the corner of the eye down. And you look after, it looks like it's not there. We haven't changed any volume on her. What's happened is that collagen has increased and has lifted and firmed her cheek so that you don't see that depression anymore. Focusing on the neck on this lady, you can see in the left-hand side that this area right here is very saggy. You can almost see a shelf where that skin just kind of sits. In the right, you can see that shrinkage has definitely occurred. Neck again, same area, same result. You're getting that, this is a great example of that shrink wrap effect, you know, but the skin is normal. You know, can you fix this with a facelift? Absolutely. But a facelift is surgery and scars. And this is actually a great way to delay a facelift. And also it's a great way to touch up a facelift, because if you have a facelift or you know people with facelifts, sometimes the neck does not respond as well as the face. And so it's a good combination treatment, actually. And here we have a lovely lady. You can tell on her skin quality actually has improved from this particular treatment. We've got some pulling up on the marionettes. And this is, she had one treatment and she is going to have a second treatment. Here we have our baseline in 3 months, focusing on that neck, that curvature of the neck. I mean, clearly you can see what that's done. Also looking at the necklace line, we call these horizontal lines necklace lines. Also her jowls, her jaw is firmer looking. These are the kind of results people go, well, you look really good, you know, they have no idea why, you know, and they're not saying, oh my God, what did you do? More neck, nice tightening. This is a heavy neck. We haven't really reduced the fat. All we've done is tighten the skin. But a nice result. If we wanted to reduce the fat, we have other procedures that we can apply with SofWave in addition to SofWave. However, this patient is very happy with this result. And if you're happy, I'm happy. I want to touch on acne scars a little bit. If you look in the center of this gentleman's cheek, you can see some deep acne scars, and over multiple treatments, you can see them gradually improving. So that last picture is 4 months after his third treatment. So when you have acne scars or scars of any kind, usually more treatments are required than if it's just laxity. Here we have a different type of acne scars. I think you can appreciate some of those deeper scars have filled in nicely, and just his skin in general looks much happier and much softer. You notice he has a beard. This does not affect the hair of the beard, so you don't get any hair loss with this, which is important to men. And a woman, fine pitted acne scars. You can do laser resurfacing too, and that's helpful. You can do a combination of laser resurfacing plus SofWave. And sometimes when you get darker skin, laser becomes less of an option. Here's a gentleman, a little bit darker skin. If we do laser, he might have a little bit of temporary pigment changes. With SofWave, we have none of that. And this gentleman, very dark skin, very severe acne scarring. So impressive, 2 completely non-invasive treatments. No problem with his pigment whatsoever, no downtime. I mean, this guy is just ecstatic that he can get this kind of result with very little effort really on his part. Let's talk about brow for a second. Looking at the placement of her eyebrows, you can see they're slightly elevated. And looking at the skin between, the upper eyelid skin, how she has what we call hooding, and that is decreased. You can see more of her eyelid skin. You see less of that sagging. And that's happening because we're doing the brow. We're also doing that area just underneath the eyebrow, not on the eyelid, but that area that's on that bone right under the brow. Now their eyes, you can see around and even in her lower eyes. So when we're doing SofWave out here, we're getting some firming and tightening that's drawing up in this direction. And also her brow is a little lifted. Again, look at the skin that's impinging on her eyelashes. You can see there's a couple of millimeters of improvement. Young woman, doesn't seem like she has anything to worry about here, but a little bit of brow lift makes her eyes more wide open, more alert, just prettier, really. And an older woman, severe laxity, definitely a good result. You know, end results depend on where you're starting, of course. Switching gears into arms. Everybody over a certain age, every woman over a certain age has some degree of this, even if you're in good shape. So this is just skin laxity. And what I'm going to do is show you where we're going to place our little soft wave quadrants here, all along that lower area of the arm. And you can see the after effect is really pretty terrific. And these are typically one treatment. Again, you can do two. Here's someone with a little bit less laxity. Nice result. More severe laxity. Nice result. The before and after shows it's working. I'm going to touch on cellulite just for a second. You can improve the appearance of cellulite. Obviously, it's not gone, but it does look better. And this would be approximately our placement for treating this particular patient. And everybody's different. We're going to assess everybody individually and make a plan for them depending on what is being presented. And just one little quick slide about, some people hate the wrinkles over their knees. So see, a little tightening over the knees goes a long way. All right, so FDA cleared, facial lines, wrinkles, lift the eyebrows, submental, neck, crepey skin on the arms, and appearance of cellulite as well as acne. Non-surgical, no downtime. Treatments are 30 to 60 minutes. It all is going to depend on how large an area you need to treat. Now the experience. So we mark the areas. I usually do that with a person sitting up on the face, and we'll do this with Tracy and see where's the best place to put our treatment. And then the energy is applied in 5-second pulses. So maybe 20 pulses in one square. And then move on to the next, and it creates that heat. Aftercare, there's really no aftercare. I do like people to use a couple of different products. One is TNS Advanced Plus, excuse me, serum, which is a growth factor. So it's like feeding your collagen. Your collagen and elastin production need growth factors to egg them on. So it's like you're feeding your garden. You've stimulated your garden, now you're going to feed it. And you can start that before the treatment, and definitely want to continue it for a good 3 months after. And then actually it's a great thing to keep in your regimen twice a day. It's a serum. And then the other is sunscreen. Sunscreen. This is a very good one, SkinMedica Essential Defense. It's mineral, non-irritating. Pretty much anybody can use it. And it's lightweight, so it's one of my faves. And what about results? Well, most patients show a significant improvement at one treatment. I think I showed you a lot of pictures of one treatment, so you get it. It doesn't have to be two, but two gives you more. So a lot of times we'll just go ahead and plan like we're going to do a second one within a month or 2 or 3, depending on if we want to wait for a final result of 3 months and see where we're at. That's perfectly fine as well. And it's a really low maintenance procedure. It's maybe once a year. We've got to keep reminding your collagen to grow because it forgets. Now I'm going to switch gears. I'm going to hand over my microphone to the lovely Annika, and she's going to go over some super specials.
Okay, hello everyone. We always have our webinar specials. So these are for today. So you get exclusive access to these for joining us today. The first one is for a jawline soft wave treatment, and that is $1,600 to get the jawline, so $400 savings. We did include an option to add on a brow lift, which was discussed in today's webinar, and that will only be $500 to add on. The full face treatment today and today only will be $2,400, so that's about $600 of savings. We did include an option to add on lip filler for that, which is $500 in addition to the $2,400. And then the last one is treating full face as well as neck. And that one is our biggest savings. It's going to be $3,200 today, and it is typically $4,000. So that's $800 savings. We have the option to add on lip filler or jawline filler. And that's something you can discuss with your provider in office, but that will be a $500 add-on for the lip filler, a $600 add-on for the jawline filler. These specials will be applied if you call today to our cosmetic coordinator. The number is 480-651-4989, or you can email the cosmetic email, which is listed below. And this will be applicable to appointments with Dr. Van Dyke, Dr. Yonan, or our nurse injector, Maya. So just hang tight and we are going to get started on the demo, and you'll get to see the SoftWave in action.
Hey, everybody, welcome back. This is Tracy, our lovely model. And we did half of her face, the left half, before this webinar started. And now we're going to do the right part. So when I sit her up, I know it's hard for you to see it, but let's try. Sit up straight and kind of see if we can get our fabulous camera woman. Maybe face the camera and don't smile. And so what we're seeing is a little improvement in this area. Again, very subtle with one treatment, but chin down a smidge. You see that that fold is not quite as deep as that fold. So we're getting a little bit of this happening. We treated her in this area. Again, this is not the result. This is just that immediate kind of collagen tightening that happens. Which is kind of fun to see. Okay, all right, I'm so sorry. I'm gonna sit you up again because I'm gonna mark you. So put your hair behind your ear if you wouldn't mind. And then what I like to do is kind of play around. Like if we do this, I'm not liking that as much as if we do this and this. So we're going to do two areas in this area to get this jawline to flatten out. Put your head straight. Okay. So we see we have a little baby jowl here and we have a little marionette line, and that's what we don't want. We want to get rid of. So here is my little handy dandy SoftWave square. So we're going to kind of mark off the margins of this, and I will make a bit of a square that fits to her face. So think of this as kind of guardrails. This is the general area, and that gives me how many pulses I want to do. So we're going to angle this one just a smidgen differently for her. And come across here. So we're going to come down here a little bit. We will have some overlap there, and that's fine. So you can go ahead and lie back. So this is ultrasound. If you know anything about ultrasound, ultrasound uses ultrasound gel. So we're going to put a little ultrasound gel on there. And here is our handle. This is that treatment tip. You can see where all the little transducers are that generate those little red flame looking things that I showed you in the cartoon. You're fine. You comfy? Yep. Okay. So I'm just going to go. Here we go. 1, 2, 3. We have gone into sleep while I was talking. So if you want to look at the screen, you can see the energy. So we're doing 5-second pulse. She's at a very good energy, is 3.6. We're going to have a cooling phase after, which is 2 seconds to help cool it off. And then I've got it set that I can do 1 pulse a second. You can see from area 1 and 2 that I treated 2 squares on the other side of her face. So now we're going to add a third area so I can keep in mind what I've done on which space. And now we should be ready. Okay, that's 1 pulse, 5 seconds. I'm going to continue to do this. You might say, Does this hurt? Well, it's uncomfortable. Now, people can have a lot of sensitivity or no sensitivity to it. And what we do in terms of comfort control is offer many different options. Some people need nothing. Some people, we have them take some Advil. We do have nitrous oxide, which is laughing gas, which kind of takes a bit of the edge off of it. Lovely thing about nitrous oxide is wears off in 15 minutes, so you can drive home. Tracy has had a couple of whiffs of nitrous oxide and a couple of Advil. And she's quite comfortable. She's feeling it. You're feeling it, right?
Mm-hmm.
Okay. So it's not like you're asleep or anything, but it's quite tolerable. I do have the ability to change the energy as well. I could lower it if she was very uncomfortable. We'll still end up getting the same result. However, it will take more passes because what I'm looking for is a total amount of energy I'm delivering to the tissue. Lower energy, more pulses equals the same target. In her, we're going for 100 total joules in this space, which takes about 25 pulses. And you'll notice I reorient just to keep everything smooth, and it moves around pretty quickly. We're about halfway done with this space already. I saw her flinch a tad, so there's a little bit more sensitivity in some areas than in other areas. I did mention that this is a great adjunctive treatment for other treatments. For instance, touching up a facelift in combination with Agnes, which is, you can go to last month's webinar and talk about that one, which is firming and tightening. Filler absolutely can be used with filler. I don't typically do them on the same day. I like to do this first and do the filler maybe a couple weeks later. Botox, you know, we're not doing Botox in this area particularly, but if we were doing her crow's feet, and I would just do the Botox the day before. Botox takes about a couple of hours to bind irreversibly, so you can pretty much do any treatment afterwards. And then lastly, laser resurfacing. I love doing laser resurfacing for skin quality, and you can do this first and immediately do resurfacing. So we're up to 19 pulses. We're almost done. Hang in there. You can see she's getting a little bit pink. But there's no wound, there's no scab, there's no crusting, there's no nothing. So I'm just going to finish up on this square for you. If you have questions, go ahead and shoot them into the chat and we'll check those in a moment. And if there's no questions, or if it's you come up with a question that I don't have an answer to, we'll get it back to you with the answer. Four more? Four more. The original protocol for this was just doing pulses all over the face, not really focusing. And what we're trying to do here is to drive heat, more bulk heat, get more heat accumulating in the area to get the better result. Last one. Okay. Thank you very much. We will finish her later. Because it is kind of more of the same. You get the concept. Let me get the grease off of you. And do we have any questions that we'd like to address right now?
We have one good one. In terms of the different protocols based on the degree of skin laxity, what would happen if you used a higher dose or level than was needed?
So say you took someone with a mild laxity who you might be doing 75 joules and you treat them with 150. It's just not going to give you more result, you know, it just might be wasting time and money. There's no real harm to it, no downtime. I'm not aware of anybody, I wouldn't do 1,000 pulses on someone. You're going to get too much heat. But we absolutely go to 150 joules on people regularly. A lot of my patients are 60 plus, 70, even 80s. We want a lot of heat in that tissue. So there's no harm to it, but if it's not necessary, we don't need to do it.
How long should someone wait before and after Botox, I think you answered, but can Sofwave dislodge or move filler?
So that's an excellent question. It comes up a lot with, can filler be moved or migrate? Well, you want that filler to be in place and sort of integrated to some degree. This is my feeling before you take something and push hard on it. So it doesn't really have anything to do in that sense with the energy. It has more to do with, I'm using this handpiece and I'm pressing pretty hard. So if I had just put filler here and then I'm pressing hard over it, I can not move it, but I can mold it in that first couple hours of filler. So I generally would not do that. After filler's been in for 2-3 weeks, it's integrated. You cannot move it around. You cannot budge it anymore. So on that score, couple weeks. On the score of the other question, people say, does the heat melt filler? Well, fillers are very, very hardy. The hyaluronic acid gels are sterilized at multiple times higher temperature than this will get. This will get to 65 degrees centigrade, but to sterilize a filler, you're using multiples of 65 to sterilize it before it's given to us. And so in other words, that degree of heat doesn't bother it. But more importantly, this is in the dermis. And a lot of the filler we do now is below the dermis, so we're not even reaching it. So I wouldn't worry about it. And I will tell you, of all these particular treatments I've done over years, ultrasound, radiofrequency, laser resurfacing, all of my patients, 90% of them have filler too. And we have never seen an issue or, ruining of our filler. So I'm not worried. All right, I think we're done. So if you have other questions, you can always email and, you know where to find me. So I hopefully this was helpful, and thanks for hanging in there for lunchtime.